This is Dr. Bouvier with Dr. and You. You came here to learn a little bit more about a weird thing called dizziness. I'm sure none of you ever come across it, but in this case we're talking about vasodepressor syndrome. Vasodepressor syndrome, that's where your brain and spinal cord get kind of whacked out. Actually, the autonomic nervous system gets awry. We don't know exactly why this happens, but it happens quite frequently, and we're going to talk about two different patients today. Today we've come across one of our delightful patients who has had this dizzy thing going on and off for a while. In fact, passing right out and out cold. And she's had the scans and she's got a link, which is an event monitor they'll put underneath the skin for really up to weeks, and we can download it, and it's a really cool way to diagnose this. But historically, she's had this dizziness and without any other symptoms. And you're how old now?
49.
49. Mm-hmm. And she's had a little bit of this probably for years.
Yes.
But, we're just now kind of catching up with it. So the way we're going to treat her, and she's tried a couple of different things, had side effects, but the way we're going to treat her is initially start out with salt tablets, and then we'll start with the other medications. Traditionally, we use beta blockers for this. Sometimes we use Zoloft, but we can use other medications too, but those in particular that we've used traditionally in the past. You're taking, or tried to take,
the mitodrine.
The mitodrine at 10 milligrams. It comes in 2.5, 5, and 10. And she had tremendous side effects, extremely tired, fatigued, wiped right out, and she had to actually go to bed. So we're gonna actually start her on just a piece of the 2.5 instead of 10, and see how that goes. Initially, you're going to take the salt tablets 3 times a day for 3 days before. Don't start that until Monday.
Okay.
Go ahead and put that on hold, and we'll go talk.
Go.
Hello, we're back again, and the second patient, similar situation, dizziness, falling to her knees, not completely passing out, but probably a different scenario. She's had, Judy, how old are you now, Judy?
50.
50. That's right, you just turned 50.
Wow.
That must be nice. Look like 30, turn 50.
Yeah,
Wonderful
she
deal.
looks good.
I was just told I looked 60 the other day.
Actually, our videographer turns 50 here.
I
Pretty
turned
soon,
50 in 2 months. Next month.
So
I just turned 50 in February.
All right.
her
Happy
situation is a little bit different. She's had a lot of different medications that potentially can interact with each other. So the first thing I think of when dizziness and going down to her knees is that there's a medication interaction. However, we haven't changed her meds for over a year. Probably, 4 or 5 different psych meds and a bunch of different blood pressure, blood sugar meds.
I've been on them for a year and a half. Latuda was the last one he was put on for my psychs, and that was last April.
Right. So, it still could be meds, but, a little bit less chance, but similar situation. So we have to, this vertigo, this dizzy issue, lightheaded issue, we have to look at endocrine issues for her, diabetes, then.
Shoot.
So we have to make sure that those endocrine issues with her, it's the thyroid, it's the diabetic issues, which are stable with her, at least historically. We'll check her labs again. And our most recent one that we did a month ago shows pretty normal. We obviously have to do the neurological, cardiac, but there's also other issues that we can take a look at, not just neurocardiac, are the ones that kill you if they're off. So she's going to get a carotid Doppler, echocardiogram, tilt table test. She's probably going to get an EEG. Certainly go back to her psych doctor and see if there's any interaction that they want to consider. Probably see a cardiologist or neurologist. But we'll have a lot of that workup done before they even hit the door of those specialists. 2 different scenarios. The first patient we found is definitely cardiac vasodepressor syndrome. She's looking like vasodepressor syndrome, and at 50 you can have that. A lot of times vasodepressor starts in the teenage years, but a lot of people give that history of being lightheaded pretty much their entire life.
I used to pass out all the time when I was in my 20s, see stars, and I was gone.
Yep. So we get this history a lot with people, and the vasodepressor syndrome will come and go. So the teaching points here are, number 1, when you get a dizziness, vertigo patient, is it truly vasodepressor syndrome? And we're going to send her over and do a line and standing blood pressure and heart rate. We've already got some recent labs. We've got an EKG pending on her. We'll probably put some sort of loop EKG on her, do the neuro test, cardiac test, Doppler vascular test, and make sure that those things aren't going on, because that's what will kill you. So the workup is very similar, but historically, when you listen to people here, like she just said, boy, in my 20s, I would get lightheaded and pass out.
Mhm.
So that gives you a clue that this is probably vasodepressor syndrome. We're going to start treating her. Actually, we're going to double up on her water intake, and we're going to give her a salt tablet. Even her sodium's a little bit low. So we're going to actually give her at least one salt tablet a day to kick things off here. She'll continue to use her cane just to kind of keep her oriented, and it'll be a good conversation. So again, this is Dr. Robert Bouvier. We're talking about vasodepressor syndrome. Again, if you want to join in on any of these conversations, please join us on Facebook, YouTube, or send us an email, and we'll add you to the list. Take care.